The next screen is the active straight leg raise. This screen places the body in a position to focus on its ability to disassociate the lower extremity while maintaining stability in the torso. The purpose of the active straight leg raise is to assess active hamstring and gastrocsoleus flexibility while maintaining a stable pelvis and active extension of the opposite leg. In describing it, the athlete assumes the starting position by lying supine with the arms at the sides, palms up, head flat on the floor, and a 2x6 board is placed under the knees. The tester identifies the athlete's anterior superior iliac spine, or ASIS, and the joint line of the knee, usually at mid-patella. The athlete lifts the test leg with a dorsiflexed ankle and an extended knee. During the test, the opposite knee should remain in contact with the board, and the lower back and head should remain flat on the board. Once the athlete has achieved the correct position, the tester aligns the dowel through the medial malleolus of the athlete's test leg, perpendicular to the floor. Have the athlete perform the test again, raising the opposite leg. If testing produces a lower score for raising either the left or the right leg, record the lower score. The athlete is allowed up to 3 chances to perform the test bilaterally. Criteria for obtaining a 3 are as follows. The dowel must reside between the mid-thigh and ASIS. Tips for testing include: the flex tip identifies the side being scored. Make sure the leg on the floor does not externally rotate at the hip. Both knees remain extended, and the knee on the extended hip remains touching the board. If the dowel resides at exactly the midpoint, score them low. The athlete will receive a score of 0 if pain is associated with any portion of this test. A member of the sports medicine staff should perform a thorough evaluation of the painful area. Now, let's review the active straight leg raise. We're going to make sure that the leg, which is down, maintains good contact, the back of the knee, on that board. This is most important before we ever start to elevate or raise this leg. In addition, once we do elevate the leg that's extended, we still want to ensure that contact and that upright position with that foot. So Steve, let's keep the left leg down, bring the right leg up. Good. Maintain a full extended knee there. Perfect. All right, so I want to justify and make sure that this leg is up. Good. When we drop the dowel, right in line with that medial malleolus. There's also no problem in actually dropping the dowel laterally, and in some cases you may need to do this to verify in case it becomes in contact with the groin area. On this screen, the most important thing, which we'd like to see if there is a limitation, is that that limitation is bilateral, as opposed to being asymmetrical and having a score lower on one side than the other. However, those things do arise. And indicating a lower score, that's obviously going to be below that mid-thigh level, which you can see is indicated right here. And this is obviously approaching mid-patella, which we will give you the scoring criteria for in the future.